Hi guys, how is everybody? I hope everyone's doing really well. So we're going to discuss mucormycosis or the black fungus today. So I thought I'll break it down into these few subtopics, which I'll just put on the screen so that it's easier for us to understand. So after this video, I hope everyone watching it can answer each one of these questions. So starting with, what is it? So mucormycosis was earlier called zygomycosis. It is a serious but rare fungal infection which is caused by a group of molds called mucormycetes. So they can be recognized, they have broad aseptate filamentous fungal hyphae. Okay, so I'll just put a picture of it here so that we have an easy understanding of what it really looks like. So where is it usually found? So these molds live throughout the environment, particularly in soil, in decaying organic matter such as leaves, compost piles or rotten wood. People can get mucormycosis by coming in contact with the fungal spores in the environment. For example, the lung and sinus forms of the infection can occur after someone breathes in the spores. It's very unlikely that a human gets infected, but it's not unheard of. It used to occur earlier in HIV patients as well. So, which brings us to our next question, that is, who is predisposed? So, mucormycosis mainly affects people who already have health problems or take medicines that lower the body's ability to fight germs and sickness. For example, people with uncontrolled diabetes mellitus, who are immunocompromised, or people who are immunocompromised due to steroids, having comorbidities such as a post-transplant patient or a patient with cancer or someone who's had a prolonged ICU stay. So people suffering from COVID-19, HIV, AIDS and other viral diseases, congenital bone marrow diseases, severe burns, untreated or regularly treated diabetes, they all have reduced immunity and they are prone to developing mucormycosis. So it most commonly affects the sinuses or lungs after inhaling fungal spores from the air. It can also rarely develop on the skin after fungus enters the skin through a cut, scrape, burn or any other type of skin trauma. So in India, we already have a very high prevalence rate of type 2 diabetes mellitus, that is 8.9% of adults in India are affected by type 2 diabetes mellitus by a recent survey. That means there are 77 million patients suffering from type 2 diabetes mellitus, and that's a very well known risk factor. There are predominantly 5 types of mucormycosis, but we won't be covering all that in this video. I'll just mention it here. There's the rhinocerebral form of mucormycosis, which affects the sinus and brain. This is what is commonly being seen in COVID patients. Right now it makes sense because COVID affects the rhino, like the nose and the throat part of the body. There's pulmonary mucormycosis, gastrointestinal mucormycosis, cutaneous mucormycosis and disseminated mucormycosis. So let's discuss what mucormycosis in COVID is. So many people who are recovering from COVID-19 of late have been afflicted by this black fungus or mucormycosis disease. The fungus invades the sinus and makes its way into the intraorbital and intracranial regions, that is inside the eye and inside the head. If its progression is not checked early, it can have almost up to 80% mortality rate. It's 50 to 80% of people, whoever is affected by mucormycosis, have a chance of dying. So while fungal diseases are very common in plants, very small amount only affect humans. And one of the reasons is that animals, including humans, they have a very intricate immune system. But whenever this immune system is breached by other illnesses, these fungus, which are otherwise harmless, they take advantage and invade the human tissues. So this is called an opportunistic infection. But even then, unlike their bacterial counterparts, they rarely cause any life-threatening disease. You must have already heard of a fungus called Candida, which can sometimes kick off a very serious infection. Candida naturally lives on the skin inside the mouth, throat and vagina of healthy persons without carrying any problems. But if the host body by any chance gets weakened by other disease or drugs, it can cause something called an oral thrush, diaper rash or vaginal infections. So COVID-19 patients who have received steroids are particularly at risk because these steroids suppress the immune system. This is why steroids should not be used unnecessarily, and it should be used only when absolutely necessary under a healthcare specialist and their guidance. These are some clips of a study that I came across on the internet. It is a well-published study in PubMed, which is a very good website for seeing peer-reviewed, cited journals and everything like that. So this is a study about bacterial and fungal co-infection in individuals with coronavirus. It's a rapid review to support COVID-19 antimicrobial prescribing. So in this recent review, they found that 8% in this study, 8% patients that they had treated had secondary bacterial or fungal infections during hospital admission. There was widespread use of broad spectrum antibiotics, with as many as 72% of patients receiving these drugs, often with no underlying evidence of infection. That means antibiotics was being overused in these patients, which led to an increased incidence of bacterial and fungal infections. Another study showed that there are specific pathophysiological features of COVID-19 that permits secondary fungal infections, which causes extensive pulmonary disease and enhances the risk of invasive fungal infections. So there's also something called immune dysregulation in COVID-19. That means the number of T lymphocytes, CD4 T cells, that is helper and cytotoxic T cells, will decrease, and that can alter the innate immunity, leading to these opportunistic infections to infect our bodies. Now coming to what are the signs and symptoms. So when the mucormycosis fungus attacks the sinuses, it can spread to the lungs, the brain and the central nervous system. So the common symptoms can be fever, headache, the reddish and swollen skin around the nose, eyes or mouth. There can be facial pain and cough, sometimes with hemoptysis, that is bloody or dark fluids coming out of the mouth or the nose, and shortness of breath. Very rarely it can present as an altered mental state. So how is it diagnosed? We do histopathological evidencing of it by taking a culture and from the site of infection, and we have to inoculate it into some agar culture. That's where the fungus, we give some source of nutrition for the fungus to grow, mostly a Sabrot's dextrose agar or SDA culture. So doctors can diagnose it through a tissue biopsy after doing SDA and an X-ray of the lungs if required. So how can we prevent or how can we reduce the risk of contracting mucormycosis? The first and foremost is to educate the society about the disease. Everyone's freaking out about this disease, but it's not unheard of and it's not uncommon, and it's very expected in prolonged ICU stay patients, especially in COVID. So next step is to control diseases of the patient like diabetes mellitus and bring it to a normal level, which is almost next to impossible because these patients are being given intravenous steroids, which will actually immunosuppress them as well as alter their sugar levels and increase it in their body. Intake of steroids and antibiotics should obviously be given in the correct timing under medical supervision only if absolutely required. There should be sampling of air in hospitals, especially in critical care wards, to check for the presence of these spores of these fungus. There should be humidifiers used during oxygen therapy, and these should be sterile. And the recovering patients should be advised to remain indoors until they gain their natural strength and immunity. And these patients who were previously engaged in farming or farmers or gardening should be advised to lay off from work until their entire disease has settled, at least for 4 to 8 weeks. Treatment of this disease is almost never successful. There have been few instances if the disease progression is not that much that the patient has recovered, but it has a very, very bad mortality rate. Up to 50 to 80% of the patients infected can die. So early recognition, we have to look out for any warning signs, even a blocked nose in an immunocompromised individual who has earlier been or recently been treated with prolonged steroids, or someone who's been in ICU for long or been treated with steroids. And we have to early or like recognize this at the earliest, diagnose and administer appropriate antifungal for improving the outcome of this patient. So normally the first line is lipid formulations of amphotericin B, and it's often the first line treatment, and patients might sometimes need the combination of antifungal medication and or cerebral or surgical debridement depending on the amount it has invaded into the sinuses or the CNS. So that's about it. That was our entire summary about this black fungus which is taking over India right now. I hope that you can now answer any of these questions which we first discussed, and I hope this video was helpful. If you found this video helpful, please leave a like, share this video with people you think it might help, subscribe to my channel, comment down below whatever your queries are or what you think about the video, and I hope you guys are staying safe and have an amazing day.